All right, week 2, wrap up with Marissa, our PT student. What she learned this week and what's the biggest aha take-home moment?
Yeah, so this week I really focus on trying to screen the whole body when a patient comes in. So I think that's really important. I think it's a step that a lot of PTs tend to miss because they just focus on the specific impairment that the patient comes in with. But in PT school, you learn to screen kind of the joint above and below. But in real life, everything's connected through the kinetic matrix and through fascia. So it's important to screen the whole body, and it takes only a minute or so and to do so. So it's something that is really important to screen, so that way you fix the problem.
Okay, and then also talk about what happens. Let's say a patient comes in, fills out your intake forms, only thinks that you're going to look at that body part, so they don't put anything else. How often did we go through a screen with somebody and it would click, oh, I didn't tell you about this?
Yeah, so that happened a lot with a lot of patients. When you go through each body part and assess muscle by muscle, then people will remember like, oh, okay, that caused me a little bit of pain, and then they'll say, oh, I guess I had knee surgery 6 years ago, and then then we got to assess the lower body. So it's important that we don't miss any pieces of the puzzle.
Okay, and then also just talk about really quick how once we put them on the table, if we start assessing something and it actually, let's say they came in for right side of the low back pain, I'm assessing left shoulder, all of a sudden that reproduces the right side of low back pain. So what does that tell you?
So like I kind of mentioned before, everything is connected. So it could be an impairment in muscles down in the low back that's affecting the right shoulder, and everything kind of crisscrosses back there. So it's important to be able to recognize those patterns and to pick out those impairments.
All right, so just want to give you guys a little glimpse into what it's like to be at 180 Physical Therapy as a patient and also as a student, so you can see what we're doing and how different it is. So it doesn't take very long to screen somebody's entire body from big toe to occiput, basically about 60 seconds like Marissa said, and it gives you a ton of information that you would have missed otherwise. And also you need to be treating and assessing the entire body, because very rarely does somebody come in and we only work on one body part.
Yeah, exactly.
All right, so if you've got questions on that, post them below and I will help you out, and maybe even Marissa will jump in and answer your questions for you.
There you go.